Welcome to the Pulse Report. I'm Dr. Shen, a cardiologist specializing in electrophysiology and the Director of Research and Education at Cardiovascular Medicine. In today's Research Spotlight, I'd like to share with you insights from a major international study published in Circulation, one of the most respected journals in cardiology. In particular, it looked at the link between AFib, dementia, and memory decline. This study, conducted by an international group of experts, took a deep dive into how atrial fibrillation, or AFib, the most common heart rhythm disorder, affects not only the heart, but also the brain. So what did this group of researchers actually do? To really understand how atrial fibrillation affects the brain, this international team of experts didn't rely on just one study or one country's data. They pulled together evidence from dozens of large, long-term cohort studies and clinical trials across the globe, collectively involving tens of thousands of patients who were followed for many years, often close to a decade or more. Importantly, they went beyond the traditional view of AFib as just a stroke risk. Strokes, especially large ones, are, of course, a well-known complication of AFib. But these researchers also considered silent brain injuries, tiny clots, and subtle interruptions in blood flow that usually don't cause sudden symptoms. Instead, they accumulate slowly over time, and they are often only visible on brain scans like MRI. Even though a person may never feel these events happening, the damage can add up and eventually affect memory and thinking. That's why the collaboration examined results from detailed cognitive testing, which tracks changes in memory, attention, and reasoning, as well as neuroimaging studies that look for signs of small vessel disease, white matter changes, and microbleeds. They also reviewed whether different treatment strategies like blood thinners, rate control medications, rhythm control approaches, including ablation, and even lifestyle changes altered the trajectory of cognitive decline. Because dementia is influenced by many overlapping conditions, the team carefully looked at how AFib interacts with other risk factors, such as high blood pressure, diabetes, obesity, sleep apnea, smoking, and inactivity. By pulling all this information together, they were able to isolate the specific ways AFib itself contributes to brain decline above and beyond these other common problems. The results were both clear and concerning. Across study after study, people with AFib were more likely to experience cognitive decline and dementia, even if they had never suffered a traditional stroke. This means AFib itself carries risks that go beyond what most patients and even many doctors may think about. The relationship wasn't just yes or no, it was graded. The more AFib a person had, the longer it lasted, or the more frequently it occurred, the higher their risk of memory problems and dementia. The article lays out several mechanisms that likely explain this connection. One of the most important findings is the role of silent brain injuries. These are tiny clots that travel from the heart to the brain or small interruptions in blood flow that don't cause sudden, dramatic symptoms like paralysis or slurred speech. In fact, many people never know they've had them. But when doctors perform brain scans, they often see evidence of these so-called microstrokes or silent infarcts. The review notes that these injuries are surprisingly common in people with AFib, even in those taking medication. Each individual event may seem harmless, but together they can chip away at brain health over the years. Imagine it like small scratches on a window. One or two might not matter, but after hundreds, the glass looks cloudy and distorted. In the same way, these silent injuries accumulate and are strongly linked to reduced performance on memory and thinking tests, slower processing speed, and eventually dementia. Another key factor is that AFib interferes with the brain's steady supply of blood. Normally, the heart pumps rhythmically, sending blood smoothly to the brain. But with AFib, the irregular rhythm can cause the flow to be erratic. Even when heart rate is controlled with medication, there can still be fluctuations in the timing and strength of each beat. This creates brief periods where the brain doesn't get the consistent oxygen and nutrients it needs. The review compares this to a light bulb flickering when electricity isn't steady. The light doesn't go out completely, but it isn't reliable. Over time, These repeated fluctuations can stress brain cells, making them more vulnerable to injury and decline. This is particularly important because it explains why some people with AFib may experience cognitive problems even if they never form a large clot or have an obvious stroke. The damage comes not just from what the blood carries, but from how steadily it flows. The third mechanism is more subtle but just as important: inflammation and changes in the blood vessels themselves. AFib is associated with chronic inflammation, a kind of low-grade, ongoing irritation inside the body's tissues. This inflammation doesn't just affect the heart, it also impacts the blood vessels that supply the brain. Over time, inflammation can cause blood vessels to stiffen, thicken, or remodel. In the small vessels deep inside the brain, this can accelerate what's called small vessel disease. That's when the brain's delicate network of tiny arteries and capillaries becomes damaged, leading to white matter changes, microbleeds, and a higher risk of both cognitive decline and stroke. It's a vicious cycle. AFib promotes inflammation, inflammation damages blood vessels, and damaged vessels make the brain more vulnerable to injury from clots and low blood flow. This combined heart-brain connection is one of the most powerful insights from the AF screen review. Individually, each of these mechanisms might not seem devastating, but together, over years, they accumulate. The review highlights how these combined effects raise the likelihood of dementia, reduce attention, and slower mental processing in people living with AFib. In other words, AFib doesn't just put people at risk for sudden, dramatic events like stroke, it can also quietly chip away at brain health, leading to long-term memory problems and dementia if it isn't detected and managed early. So what does this mean if you or someone you love is living with AFib? First, early detection matters. AFib is sometimes silent with no obvious symptoms, but finding it early allows doctors to start treatments that lower both stroke risk and brain injury risk. Second, anticoagulation or blood thinning is critical. It doesn't just prevent the big, catastrophic strokes. It may also reduce the smaller, silent injuries that quietly harm the brain. Third, keeping the heart rhythm under control helps. Whether that's through medication or procedures like ablation, maintaining a steadier rhythm can support better blood flow to the brain. Fourth, lifestyle changes remain powerful. Controlling blood pressure, diabetes, and sleep apnea, staying active, eating a heart-healthy diet, and not smoking all protect both your heart and your brain. Finally, don't ignore changes in memory or mood. If you or your family notice increasing forgetfulness, difficulty concentrating, or trouble managing daily tasks, don't wait. A simple ECG can pick up AFib, and quick memory screens can detect early signs of decline. The earlier we know, the better we can intervene. This international report also reminds us that screening for AFib, especially in older adults, can make a difference. Sometimes it's as easy as checking your pulse, using an ECG at your doctor's office, or even a home device. Lifestyle also matters. Exercise, healthy eating, good sleep, staying socially active, and keeping blood pressure and diabetes under control all protect the brain. Here are a few things to keep in mind. Symptoms of AFib can include a racing or irregular heartbeat, shortness of breath, fatigue, or lightheadedness. Sometimes the signs are subtle or come and go. Subtle cognitive changes, like forgetting recent conversations, struggling to plan tasks, or feeling mentally slower, shouldn't be brushed off as just getting older. Simple tools like an ECG at your doctor's office or even home monitors can pick up AFib. Brain imaging and new biomarkers may also help detect early changes in brain health. To sum up, this isn't just another study. It's a major international collaboration published in Circulation that confirms what many of us suspected. AFib affects not only the heart, but also the brain. By detecting AFib early, treating it carefully, and paying close attention to memory and cognitive health, we can lower the risk of dementia and help people live fuller, healthier lives. Thank you for listening to the Pulse Report. I'm Dr. Shen. Let's keep your heart and your life going strong and in rhythm.